Stacey. I'm a physiotherapist by trade and one of the postdoc researchers at CP Achieve. And today I'll be presenting the outcomes of a systematic review and meta-analyses on the effects of community-based physical activity interventions on adolescents and young adults with disability. This study has been a team effort, and I'm presenting on behalf of my wonderful colleagues, Dr. Claire Willis and Professor Nora Shields. We've done this together. So our work focuses on physical activity participation in the community. Adolescents and young adults with disability tell us that this is what they want. And Oliver Hunter, I think, summarises it perfectly by saying you have to take exercise out of the clinical space and get it into the community. So given that, it was the aim of this systematic review to evaluate the effects of participation in community-based structured physical activity interventions for young people with disabilities across the domains of the International Classification of Functioning, Disability and Health, or the ICF. So for studies to be eligible for this review, they needed to be randomized controlled trials with community-based physical activity interventions, and they needed to include participants with disability of any kind, aged 13 to 30 years. We searched 9 electronic databases with key terms from earliest available until February 2021. And actually, we've just done a refresh of that, so I should update you on that later. We assessed the risk of bias of each trial using the Cochrane tool and developed a custom tool for data extraction, and we used 2 reviewers for all of these tasks. Data analysis included descriptive analysis of the included articles and trials and calculation of the standardized mean differences and 95% confidence intervals. The outcome measures were classified and mapped to the different ICF domains, and where there were 2 or more trials that investigated the same outcome, data were combined using a meta-analysis with a random effects model. So we identified 3,893 articles, and through the process of review, we were left with 17 articles describing 13 different trials. There was a bit of variation with the risk of bias results. In most cases, the lower scores were attributable to a lack of detail in the reporting, which you can just see there. So overall, there were 396 participants across the 13 trials. Only 1/3 of these participants were female, and the mean age range was quite young at 18 years. We included people up to 30. Young people with a range of disabilities were represented, though 62% of participants had Down syndrome. The programs varied a bit in whether they were group or individually based. There was a wide range in program duration, you can see there, between 8 and 36 weeks, and a variety of community locations were used. Most common were the gymnasiums. There were 48 unique outcome measures identified, and we mapped them across the domains of the ICF, which is pictured here. Just a warning for the next slide. It's not for you to read every item. Don't fret when you see it, but just to provide an overall impact of the mapping. So there were 23 measures that assessed body structure and function, which you can see in that navy blue color. 18 assessing an activity, which is in the pink. 5 assessing a contextual factor, down here environmental and personal in the teal and the purple. But there were no measures of participation across the 17 articles and 13 trials. We were able to complete a meta-analysis. Data from 11 trials were included, and I'm just going to whiz through some of the key results for you. There's a lot of information in the next few slides, but the most important thing to look for is the diamond shape in each of the graphs. I don't know if my cursor is working to show you, but you can see the bold diamond. This shows the results when all of the studies are combined, and if that diamond shape is clear of the center line, then it means the effect is significant. The left and the right sides of the diamond represent the 95% confidence interval. So we can see here that there was a significant positive effect on upper body strength for participants in intervention groups versus control. And the mean difference between groups was 9 kilograms. There were significant positive effects for lower body strength too, immediately post-intervention and at follow-up for 24 kilograms and 21 kilograms respectively, which you can see there with the diamonds. Waist circumference also went, there was a significant impact, and it went down by 5 centimetres for those in the intervention groups compared to those in the control groups. There were significant improvements in 2 of the functional activities. There was a reduction in the time taken to complete the timed up and down stair test, and an increase in the number of boxes stacked during the box stacking test. The effects of community-based physical activity interventions on adolescents and young adults with disabilities on other measures of body composition and other functional tasks remains unclear. Need more information for that. So the takeaway messages from this systematic review and the series of meta-analyses are that community-based physical activity interventions for adolescents and young adults with disability increase muscle strength. We saw that with upper and lower limb, increase functional activities, and reduce waist circumference. Future research needs greater inclusion of female participants and those who are young adults, so in their 20s. We consistently hear from young people with disabilities that they want to increase their physical activity participation in the community, so we need to measure it. And at the moment, that's easier said than done, as the measures of participation suitable are extremely limited. So it's a bit of a watch this space. Thank you for listening.